Hi, everybody. Welcome back to an episode of Fertility in Focus podcast. Today, we have with us a very special guest. Dr. Kevin Jovanovic, MD, is a board certified OBGYN and cosmetic surgeon. He has been in practice on the Upper East Side near Naterna Institute since 2004 and has an accredited surgical facility with AHC since 2009. They are a full-service OBGYN and cosmetic surgery practice. He delivers babies. He also does hormone type therapy, which we're going to get into. He is a talented surgeon. He can rejuvenate your parts down there, and he can do your face as well. We're very lucky to have him here to walk us through all of it. He does every kind of women's visit that you can think of, treating fibroids, a variety of challenges with fertility and pelvic pain, on top of cosmetic type of treatments like Botox filler, liposuctions, and medical weight loss, tummy tuck, and vaginal rejuvenation. We're going to be getting into his bioidentical hormone replacement that he's been into for 25 years and has very much refined and seen results with fertility in the last few years, and probably beyond that. In fact, he's very astute in pellet hormones for men and women. This is an area that I actually don't know much about, so I'm excited to get into it. These bioidentical hormones are inserted under the skin, and they are made up of testosterone and estrogen and individualized to each patient, which is really the key. So thank you so much and welcome, Dr. Jovanovic. Thanks for being with us. I'd
Thank
love.
you so much for having me, Dr. Burns. I really appreciate it.
Great. So tell us a bit about your practice and how you even started looking at the hormones and fertility.
Sure. I've been an OBGYN since 2000, and the history of OBGYN goes in waves of sort of fads and fashions. But before 2002, every single woman in the country was on hormones. 15 million American women were taking Premarin, which are actually made from pregnant mares, from horse urine. So these 50 million American women were on hormone replacement for the last 50, 60 years. So when I first started being an OBGYN, hormones were great. They saved the world. They kept you young. They protected your heart, your bones, your brain. And then all of a sudden, this one study in 2002 shattered that and said, oh, the Premarin causes breast cancer. It was called the WHI. It had more than 10,000 patients in it. It sounded like a great thing, except that it was statistically flawed. They basically made a mistake in this calculating the statistics. So they said that you had a 25% risk of getting breast cancer if you were on these hormones. And every woman was like, oh my God, 25% higher risk of breast cancer. But statistically, it was two people out of 10,000. And because it went onto
Wow.
the front page of every newspaper in the country, every woman stopped their hormones overnight. So that was me at the beginning of my career. So I graduated from residency. I was in residency at Yale, and I came to join my dad in practice in OBGYN. And we started to innovate our practice. We did do cosmetic surgery like tummy tuck, liposuction, Botox filler. And we also do a lot of pelvic floor, cough, sneeze, lose urine, prolapse repairs, vaginal hysterectomies. So we work together on all these traditional OBGYN things. And then we started to innovate into our cosmetic practice. And patients started putting two and two together. They said, hey, wait a second, you do cosmetic surgery and you do pelvic floor. What about vaginal rejuvenation? What about the G shot? And so I looked in the books, there's nothing there. And so I traveled to Beverly Hills and trained with Dr. Matlock. He's the inventor of these procedures. And we do a special procedure called the laser vaginal rejuvenation. So I've been doing that since '07. And so we put all of this together, and our practice just goes in multiple different fun directions. But basically, patients don't come in a box. So as the patients walk in the door and say, hey, Kevin, I'm interested in this, I'm interested in that, we see where the practice goes. And of course, we look for the most innovative and safest things. So, for example, in the face, there's a lot of great Botox and fillers, but I don't do facelifts because facelifts are very traditional. Yes, there's newer ways to do facelifts, but the actual facelifts are big, long surgeries that with a lot of problems and long healings. So I'm not interested in that. I'm not interested in doing something that's morbid. But our tummy tucks, for example, are not the same tummy tucks that were done 25, 30 years ago. We don't cut all the blood vessels. We don't have as many complications. We don't have seromas. We don't have all of those things because it's a different technique of doing it. It's using this special tumescent anesthesia. We also do the laser lipo. So all of these newer innovations came while I was doing this. So hormones took that same route where hormones were bad for a while. And then things came back to this idea of that maybe hormones can be replaced in a different way than doing horse urine. So that's where the pellets came in. We've been doing pellets since 2020. We do about 100, 120 a month, both men and women. And so we replace hormones by restoring to levels you had in your 20s. So we don't make you somebody else. We take your blood, it's individualized, and we see what you're missing. So whether it's 20-year-olds or 90-year-olds, you're not all going to be on the same protocol. And then we insert the pellets under the skin and they dissolve, they become part of you. So bioidentical means your body doesn't know it's not you. As opposed to, for example, birth control, which is synthetic, that's on purpose. We want to control your body. We don't want you to get pregnant. These work with your body. So we've been doing all of these pellets and we started noticing that some patients got their period back. And we looked inside and they'd been in menopause in their 50s for years. And we do an ultrasound like, Kevin, you made me bleed. I look inside and hey, it's a real period and their egg is coming. And we even noticed that some 30, 40-year-olds, we put them in and they get pregnant right away. So I approached several fertility centers to talk to them about, hey, you know what? I've been seeing this. Do you guys know anything about this? I also went to the literature in our PubMed, which is the big place where you look up medical research. I found 60 different citations of using testosterone specifically or hormones to rejuvenate fertility. So now we've been working with a Generation Next to try to see if we can get patients who can't get pregnant or who have diminished ovarian reserve to actually start making eggs on their own. And we have had some success. We haven't had any pregnancies or babies yet, but we're just starting within the last 6 months to do this. So it's exciting to see where these different things end up. Like I said, my practice has meandered through lots of different things, but something that started as a beauty and anti-aging and fun health thing is now looking like it may be an adjunct to fertility too.
No, it's an interesting thing as a clinician because we may start in one area with the patient and then move into a different type of therapy and then we may have an unexpected result. Like for example, you're doing something for their hot flashes or to rejuvenate their sex life and suddenly they're ovulating again. It's maybe not what you were aiming for, but then you get to observe clinically what happens and then you get to build on that. That's one of the fun things about being a clinician of various kinds. And it's really great that you were passionate enough about it to try to connect with people in the fertility realm specifically to see what opportunity would be there. Now, I'm curious about the testosterone, right? Because we have a lot of focus on estrogen and progesterone when it comes to fertility. And testosterone, see that focus a little bit more when somebody's in perimenopause, menopause as a way to get some muscle tone, get some sex drive back, that kind of thing. But I'd love to hear from you. Why would testosterone get somebody ovulating again?
Well, so first thing, let's back up for a second. The idea that testosterone is a male hormone is 100% misogynist. Women make more testosterone in their whole reproductive life than any other hormone. So women need testosterone. So if we could start with the basis that, hey, this is not something that's a male hormone or something that is bad, which some patients do associate that. For example, polycystic patients, we tell them, oh, your testosterone is high, that's bad. We need to drop it. Well, not necessarily the case. It does a lot of different things for women. There are testosterone receptors in every part of a woman's body, from their heart to their brain to their muscles to their skin. So women need the testosterone. So the question is just about individualizing who needs it for what. And that's the cool thing about what we do is we have the data says that actually both sexes after 25, the hormones start to change. So in that perimenopause, that from late 30s to 40s, when women are very symptomatic, the hot flashes, night sweats, the mood, everything is changing really rapidly. Part of it is you're born with all your eggs. So as you go through life, the eggs get a little less reliable in the 30s and 40s. A period may get heavier, may get lighter, but a lot of the symptoms are actually testosterone lowering. And we find when we restore that, all of a sudden everything works better. Patients will lose weight, patients will get muscle mass, patients will have better sex, like their body just works better. So it makes sort of sense with the sense that the ovary is struggling to keep up, and now we've given it a boost with the testosterone. The other thing is, what is the source of testosterone in women? Is actually two, the ovary and the adrenals. So once you restore the ovaries, hey, wait a second, I feel like my hormones are back. Maybe it's not the clock I'm supposed to be. Maybe I'm not really 45 anymore. Maybe I'm supposed to be 40. So there's not a specific etiology like figured out as to how the testosterone, but theoretically it makes sense because everything in the body works better, and the ovary is actually the source for most women on testosterone. So now you've boosted the ovary itself, and that's where the eggs come from.
That's really interesting. And so what are some of the testosterone specific like deficiency symptoms? I mentioned like muscle tone or low sex drive, but I remember offline you were saying maybe mood. So tell us a bit about if somebody comes in, you haven't tested them yet, what's going to pique your sort of spidey sense that they're testosterone deficient?
So everybody's different, and that's the fun thing about hormones too, in the bioidentical sense. If there are other hormones which we'll talk about, but if bioidentical, you have your level, and I'm just adding back, not changing you, adding back what you had before. Synthetic hormones are different. When you take a synthetic hormone, your body turns off. So when you stop that synthetic hormone, your body has to turn back on. So they do that with birth control all the time. Women who have been on birth control for a little bit, say a year or two, they stop. Their period doesn't come right back on. So they have to wait to figure out what their body's doing. That's not the case for bioidentical. So with bioidentical, we add in the testosterone, and every woman can feel different things. No one's the same, but the typical testosterone symptoms are energy, muscle mass, libido, weight, mood, sleep. Sometimes it's hot flashes, so a lot of times it's mood, but sleep is a big one that everybody says the same thing, and people wouldn't associate testosterone with sleep. But if you're not sleeping well, your cortisol level is going to go up. You're going to have all kinds of other things happening at the same time. So it really is everyone's different, but a lot of things are surprising when you talk about when patients are really upset about how they feel. The other example I can tell you is in the late 30s and 40s, the sort of perimenopause complaints, a lot of regular OBGYN will say, oh, it's your period. Let me put you on birth control to control your period. So remember, that's synthetic. And what a lot of patients will go on the birth control and actually feel worse. And hey, doc, I went on this thing and yeah, my period's a little better, but I feel worse. I can't sleep at all. I can't have sex at all. I don't feel anything anymore. I'm like yelling at everybody. I'm crying at every movie. And why is that? Because birth control, not only does it control you, but it makes your testosterone zero. And that's part of what birth control does is it actually turns off your ovaries. So of course, like I just said, the ovaries make testosterone. So those are all those patients that would raise my spidey senses, ones that are really having those perimenopause complaints or even in 20s and 30s, hot flash, the energy, muscle mass, libido, weight, mood, sleep. And then the ones that say, hey, I went on birth control and I was crazy. It made me way worse.
Oh, that's interesting. So that's a new one. And honestly, like in the field of OBGYN, it is often my experience that birth control is like the cure for everything. You have painful periods, birth control. You have skin problems, birth control. You're not having periods, birth control. Like it drives me crazy how uncreative it is, to be honest. So I really love our conversation that you're like, maybe there's a better way, and maybe there's something that the body needs to become more enlivened again.
I'm not bashing all of birth control. Birth control is very useful for a lot of
Yeah.
different things, but at
But
some
not for
point,
everything.
right, it's
Yeah.
not a band-aid. And like we talked about, there's a number of patients who tell me, hey, I feel worse. So you have to not just say, suck it up. You have to say, okay, why do you think you feel worse? Maybe we should draw blood. Maybe we should see what's going on. Maybe there's something else.
No, it's a really good point because I would say fairly constantly encountered some patients feel a lot better on birth control, but I have many saying they feel disgusting actually, like emotionally, like fragile and just bloated, and some even actually develop insomnia from birth control. So this was an angle that I knew that it was a suppressant. It's like putting to the ovaries to sleep. And it's one of the reasons why I actually don't love it for approaches to fertility, though I understand its place. And it also can lower your AMH level temporarily or maybe permanently. You can tell me maybe the answer to that. Does it lower AMH permanently in some people? Or is
I
it
have not found, supposedly AMH is a great test that it doesn't matter your point of your cycle, it doesn't matter this, doesn't matter that. But I've consistently found that people on birth control, I have no idea. Like I tell them not even to measure their AMH because
yes,
I don't know how to read it because I'll have people who
it won't be
it says it's
accurate.
amazing and other ones that say that they're 50 years old.
No, I had a patient not that long ago who came from a fertility doctor and said, "I my AMH is incredibly low, so we're going right into banking my eggs." And I said, "That's interesting." And she had said she was on birth control. I said, "When did you get off?" And she said, "A month ago." And I said, "Did you do that test while you were on the birth control?" She said, "Yes." And I said, "I'm not sure why you're being told that you have a very low ovarian reserve when it was tested when you were on the birth control. And I don't know how ethical it is that you're being told to go forward with this whole thing." How much time do you think they need to be off the birth control to have get a bit more read on the AMH?
Like I said, I'm a little bit old school because I'm in my 50s. So I like things that have been around the block for a while and make sense. The pellets, like we're going to talk about, those have been around since 1930. But
Wow.
for me, the day three FSH is still a great test
Mhm.
because it tells us exactly in that cycle where you're at. And if it's really elevated at any point in time, they used to say you're as good as your worst day three FSH. But what I tell patients is, okay, when you stop the birth control, you get a period, right? That's not your period.
Mm.
So you wait till the next period that's yours.
Got it.
And then you come in day
Just
two
a
or three.
withdrawal bleed the first time.
Correct. It's just because you stopped the hormone.
Yeah.
So once you get your next period that's yours, let's just see. And you're right, that first ovulatory cycle after birth control may not be the best, but a lot of people, of course, with fertility concerns don't want to wait a few months to get some data.
That's
So
it.
I tell them just the first real period after the withdrawal bleed from stopping the birth control to come in day two or three, let's get a FSH and AMH and see where we're at.
No, that's good advice. Now, on the topic of FSH, because this could be a marker of ovarian aging, right? That, you're not going to have great response to IVF stimulation if you have a high FSH. Have you seen FSH adjust with some of these hormonal therapies you do, the pellets and otherwise?
Yes, we've definitely seen that. It's tough because I don't want to give someone too much hope on these things. Ultimately, all I care about and the patient is I want you to have a baby. But it does improve the function of what, and you can even measure it. We have had luck, even with our cycles, with people who are in their 50s doing them with fertility centers where they made one, two eggs, and now they're making three or four eggs. Does that mean they're going to have a baby? I don't know. I'm not sure the 50-year-olds can have their own eggs make babies, but that's what we're hoping for.
It's the fact that you're working on it and seeing how it goes, I think is really the key. And I know that at Gen Next, they're also doing the ovarian rejuvenation with the PRP. So who knows, at some point it might be a combination of your pellets and like really refining that down and then adding something like that to it to really make the magic happen. I think there's just going to be a ton of innovation like there are in other areas, AI, tech, whatever, that the body is going to be an area that you're going to be innovating in. And I think that this bioidentical hormone, this like gentle, intelligent, in harmony with the body type of approach is going to be really promising for fertility and all other female complaints. Now, what have you seen on the male side of things with some of this therapy, like improvements in sperm and life and all of the things? Tell us how it works with maybe some of the ladies listening want to fix their men.
Yes, no, actually, that's how we get most of our men through our women because obviously I'm an OBGYN. They send their spouses, their friends, whomever. And I would tell you on the male side, it's amazing because I was there too. I've been on the pellets 6 years. So my story I'm 51. At 45, I measured my level. And for us, we aim to restore you back to your 20s, which the level for testosterone is about 1,000. And I was 260. I was the same as a 65-year-old, even though I was only 45 at the time. And it was probably precipitated because at 43, I ruptured my Achilles playing soccer with the kids. And I don't know how familiar you are with that injury, but I couldn't walk for 6 months. I was on crutches seeing patients for half a year. So it was really, my whole body fell apart. Couldn't sleep, couldn't run, couldn't do anything. I was going to quit delivering babies because I just couldn't function anymore. So now I'm back to me. I do 2 or 3 babies a week. I run 4 miles 4 times a week. But the cool thing is, like, you can feel in your body the difference. So for guys, I don't want to say reawakening, but it's not subtle. It's like dramatic when we get those patients. My youngest patient is 18. And when the mom brought him in, I said, no, he's got to go to the pediatric endocrinologist. There's something wrong with him. We got to figure out because there's no way that an 18-year-old should have the hormone level of a 75-year-old. And he had every test on the planet. They told him he's fine. And I was like, I know he's not fine at 300. So we pelleted him. He's in college. He's the happiest college kid you can imagine. But that's the thing is that for guys, there's a lot of denial because it's not a dramatic menopause, right? For women, it's like a sudden, where'd my period go? I feel horrible. But for men, it's almost like landing a plane. It's like this slow sort of, yeah, I got a little more fat around the midsection and I don't sleep so well. Maybe I'm a little more depressed. Maybe I yell at people a little bit more, but I'm fine. Uh, so maybe I have a little erectile dysfunction, but I'm fine. For guys, it's really tough to get them to look at that. But what I tell people is let's just draw blood. That happened to me. I was a little in denial too. And I looked at my level. I was like, I'm going to try it. That's the cool thing. Because again, if you try it and you don't like it, you go back to what you were before. It's not something you're stuck on or something that's going to leave you in withdrawal. It's not like synthetic testosterones or anabolic steroids. A lot of the male testosterone stuff has a really bad rap because of what athletes abuse. This
Yes.
is nothing close to what athletes abuse. We are not anabolic. We are not synthetic. We are not 30 times normal. We just want to give you back what you're missing. So on the male side, the men are really super happy. Now, in terms of fertility, it does tank your sperm.
It tanks your sperm?
Yes.
Oh, interesting. Why does it tank your sperm?
We don't know exactly. It's because it's bioidentical, it's supposed to work with your body, and we don't lower your actual production. But something about the testosterone replacement causes the testicles to shrink a little bit and the sperm production to go down. So it's not a form of contraception. If you start out with 100,000 sperm and I drop you 50%, you could still get people pregnant.
Mhm.
So it's definitely not contraception because some men make a lot of sperm to begin with, but it does lower your counts. So we do that timing wise. So for example, I had a 33-year-old guy, he's getting married, and he did his testosterone level, and his dad, who's in his wedding party, is 75, and his dad had a higher testosterone level than he did.
Oh my
So
God.
we got him on the pellets. He lost 85 pounds for his wedding. He felt amazing. He's the happiest groom on the planet. They go through their wedding, and I was like, okay, when are the kids thing? So what happens is the pellets last 3 to 4 months, and after that, it takes about 6 months for your sperm to come back. So again, it's bioidentical. So if you are planning, you're going to say, okay, it's 9 months from the insertion that I can start trying. I'm not saying that you can't get pregnant on the pellet. I'm just saying that in terms of
Not
planning,
ideal.
like I want to try to get pregnant next summer. Okay, we'll put in one more pellet. We won't put any more in. There are treatments that you can do to protect the sperm and protect the testicle size. It involves giving beta HCG shots to yourself 3 times a week. So that does preserve sperm function and preserves testicle size. So if that's a big concern, like Kevin, I really want to be on pellets, but I don't want to give up the sperm, we do have treatments for that. But generally, we try to time it where we're going to make your sperm come back right around the time you want to start trying anyway.
That's so interesting. Now, is it the beta HCG? No, it's the human growth hormone that women use to, or that's used by some fertility doctors for their fertility. Do you do that too, or is that something that you understand and could explain?
Sure, we use HGH. Sorry, we don't use HGH. HGH is used for like athletes who, again, anabolic stuff. Like, I don't know if you're a baseball fan, but that's what Andy Pettitte and Roger Clemens and those famous Yankees got in trouble with. So it's for increased muscle, lose fat, beautiful skin, anti-aging, but it's also for recovery.
Yeah.
So in sports, it's used a lot. It's what, if you follow popular culture, if Andre the Giant, who was a wrestler, he had gigantism because he had a HGH tumor when he was a kid that made him grow so huge. But if you take HGH later, it's somewhat dangerous if you do it too long. It causes enlarged hearts, it causes problem with the bowel, it causes cancer. So we don't use that. We have analogs, peptides for growth hormone releasing hormone, where we convince the brain to make your own growth hormone. So we do
Oh, I
use
definitely
growth
want to talk
hormone.
about the peptides, but
So
sorry to interject. The human growth hormone, I think it is being used in IVF cycles in small doses, though.
it is in small doses for short amounts of time.
Okay, got it. So it is being used, and it's stimulating the ovary to work harder.
So the growth hormone idea is that when you're young, you have something called a thymus gland. which is
Yeah.
just below your thyroid gland in your neck.
Mhm.
And the thymus gland is believed to be like the fountain of youth. It cures cancer, it cures inflammation, it cures everything. So one of the theories that growth hormone is thought to do is to regrow the thymus gland. Its direct effect on the ovaries and fertility, that one I'm not sure, but growth hormone is definitely a metabolic boost. And that's why people use it in terms of athletics to gain muscle, lose fat, and look great, whatever. But it does have potentially a whole bunch of other side effects if it's used at high doses or all the time. So what IVF does is use short bursts to actually stimulate the follicles even more.
Okay, that's so interesting. Thanks for explaining that. Okay, peptides, because I know this is within your wheelhouse too. This is an area that I am honestly not an expert in at all, and I would love to hear what are the benefits? When would you prescribe this? What's the magic of peptides in your opinion?
So peptides are what I always joke is that if hormones are the 100 level class in college, peptides are the 200 level class in college. So peptides are just a short chain of amino acids. So the FDA has defined it, I think it's 26 peptides or less, and they come in different things. But the most famous peptide is, of course, semaglutide or Ozempic. That's actually a peptide. So what we do with peptides is change the body. So we have peptides obviously for weight loss. We have peptides for beautiful skin, anti-aging. We have peptides to make you look like a tan even though you haven't been in the sun. And then we have peptides for better sex. So we use those in conjunction with hormones because sometimes the hormones can only do so much. Hey doc, I feel great. My skin is better, but the sex is still not great. How can I get help with that? We use the sex peptides. Hey doc, before I did the hormones, I put on a whole bunch of weight because I felt horrible. Now I'm getting back to the gym, but I just want a little help losing this weight. Okay, let's do that. So those are all the different things that we can do with the different peptides that we have. There used to be more peptides. There used to be peptides that did inflammation and even lower your risk of cancer and fix irritable bowel and a whole bunch of different things if you delve deep into peptides. And the FDA banned all of this about 4 years ago. A lot of them that are left are somewhat restrictive in what we do. For example, one of the famous ones that was banned was NAD, which has come back huge, which NAD is a basically anti-inflammatory. So it used to be you could take them in pills. Those were called NMN. Those were banned about 4 or 5 years ago. So we have these different things now where you inject NAD or put it in an IV. So all of these things that you hear about peptides doing these incredible things are no longer right now available. We'll see as the safety trials come back in and what the FDA allows us to use. But the peptide world used to be like the Wild Wild West. It used to cure a whole bunch of things. Now it's much more limited to anti-aging, to weight and skin and beauty type things. The other thing you may hear peptides is in all the beauty products that we have, the problem is always getting through the skin. The skin is a great barrier. So just putting a cream on your skin, very little of it gets absorbed through the skin or into your bloodstream. So that's what a lot of beauty products, when they say, oh, peptides are in it, means that it's just more effective in getting through the skin.
Oh, this is fascinating. I had no idea that there was a big ban on it because NAD is pretty prevalent. You can do the infusions. I think they make people feel a bit sick. My understanding of doing the injections is the short half-life. We prescribe them in patches. We have good results with that. But I didn't know that there were enough people that had adverse reaction to peptides that the FDA would ban them.
I think it was a safety thing because they didn't know the safety of it. They wouldn't,
Okay.
you
So,
have to, for the FDA, you have to prove that something's safe. So
oh.
when it's a peptide and there's no one watching or
Mhm.
no one regulating, then they don't know, okay, how do you cure Crohn's disease if you're not a drug? How do you cure inflammation if you're not a drug? Because peptides are not regulated like drugs.
But then vitamins and herbs aren't regulated.
True,
And they can be harmful if
100%,
prescribed improperly. Like you could
100%.
a lot of people think that if you're taking a natural thing, it's natural, so it won't harm you. But no, you can absolutely do damage with supplements and herbs if they're not prescribed
And
appropriately.
even with peptides, same thing is you have to vet who's making your peptides, right? Same thing with your vitamins. You
Yeah.
have to see what's in it, who's making it. So we've used several pharmacies through the years that are big, huge, very reputable companies, but we know that there's other things out there that are showing up in the news media, like the Hims thing where they were getting their peptides from China. You just have to really vet where your product is coming from, who's making it, how much are they making, what's the quality of the product. Because you're right, if there's anything else in it, you could be harmed by it.
Well, yeah, I am finding a trend of a lot of patients using ChatGPT as their medical advisor. And I think ChatGPT can be so useful for so many things. I don't think it should be prescribing peptides, hormones, and the like. And although it can pull from a lot of different sites and give you a summary of things, I think the best thing that you can do for yourself is to consult an actual clinician with clinical experience that can tell you from their experience, not only theoretically what might happen, like in a book, for example, but actually what they've seen happen in their patients, the potential for side effects, and what is also the upside. And on that note, with the peptides or some of this hormone therapy, what are the risks? Because I know that would be a question that we get.
Yeah, definitely. Can I tell you one funny story?
Please.
About a year ago, I always ask patients how they found me when I have a new patient.
Yeah.
And the patient actually said, AI recommended you. And I was like, okay. So I went Googled myself and it says respected reviewed doctor. And I was like, okay, AI, let's go.
Yeah. You're like, thank you.
I had nothing to do with it. I have no idea how that happened, but I'll take it.
They've taken I actually when I was looking for the right bio for you to make sure I introduced you appropriately, you had a lot of great reviews. And
Oh,
listeners, like we were on a panel together, a fertility panel to talk about egg quality and innovative therapies to improve IVF outcome for poor responders. And Dr. Jovanovic had really interesting things to say about these hormones, and he's not pushy, not salesy, more just like, I have clinically observed that this could be a helpful thing and I am exploring it further. And you can draw blood, you can take a look. Like this is like simple, kind of non-invasive stuff. You obviously offer the more invasive stuff for people at the different stages, but it's really nice to know that you have something safe that you've observed to be effective that has the potential to make advances in this field.
yeah, it's fun. You have to just go with your patients, and I like you see from our reviews, lots of great patients. Patients will guide you too, like we were talking about earlier, is that once they go down the different roads and they'll bring me stuff from AI, and I'm not afraid. Hey, bring me and let's look at see what it is. When I was at Yale, they used to say, you can't just read the conclusions of study or the taglines of the study. You have to read what they actually did and
Yeah.
who are the patients they looked at. You actually have to analyze the data of the study to see if it makes sense for what you're looking to answer. And the same exact thing is true for AI. If you don't look at what the AI pulled their data from, then you're just getting a tagline that says, oh, this is good, this is bad. But if you read through, some of it may not make any sense at all because the AI is not smarter than you. The AI is just pulling data together. I'll give you an example. We were trying to figure out when my son's college family weekend was so we could get airplane tickets. And my wife put it in Chat GPT and it said a weekend in September. And my son said it was another weekend. I'm not sure if this is right. And then she clicked on it to look at the data and it gave the wrong school.
Yeah.
So at the top, it said Duke, which is where my son goes. And at the bottom, it says the data was from Villanova. And they're like, wait, those are not even in the same state. Like, why would you get that confused? But that's what they did.
No, that's it. Again, very useful tool, very useful in bringing questions to an open-minded OBGYN and surgeon to get them answered. And it sounds like you're willing to play ball with your patients. If they want to go and have a dialogue and really understand what the therapy is and what they're doing, then you're willing to explain, and that's wonderful. I don't want to leave this conversation without touching on a couple more things. One of them is like the weight loss therapy. And I'm hearing that like peptides could help with that. I'm hearing that testosterone could maybe help with that. I know you also do the GLP-1. And because I want to know like the overall benefits you've seen and strategies, but also as in regards to fertility, what do you see that weight loss has been really helpful? To what degree? And which therapies have you found to be very helpful for that?
So just to answer your question overall, overarching, that's not new. There's a lot of data on weight and fertility. It follows into a bell-shaped curve where if you're too skinny, you can have trouble with IVF cycles and fertility.
Yeah.
If you're too heavy, you can have trouble with IVF cycles and fertility. So there is definitely a sweet spot of the normal range BMIs, maybe slightly into overweight BMIs, where you definitely do better on all fronts of fertility if you're in those ranges. And you know what? That makes sense. You want to be healthy. So those are the ranges that definitely we aim for when it talks about fertility. But if you want to give the most stark example, the polycystic patient who is already got a hormone imbalance that's worsening their weight gain. So they're gaining weight because they have an imbalance from their hormones, from imbalance from the metabolism. And the more weight they gain, the worse the imbalance gets. And then they can't even ovulate. They stop having their period. So, of course, if you don't have your period, you can't get pregnant. So, those patients, you can't even get them to start a fertility discussion without talking about weight loss, because if you bring off the weight, they start getting their period back. Now they have a chance to get pregnant. So, that's the most extreme example. But for sure, nowadays we have a lot of great tools to help people lose weight. So, the key to losing weight is very simply diet and exercise. But if you delve into that, you really do need to eat breakfast, lunch, and dinner. So there's a lot of data on fast and cleanse and all of those things, but those are confused because a lot of the data has to do with longevity, like living longer, fast and cleanse, okay, but actually getting pregnant or getting healthier, there's very few doctors that recommend fasting for getting healthier.
I
And for
love that you just said that because I have a lot of people being like, I'm intermittent fasting. I'm not eating till 2 o'clock in the afternoon. I'm like, oh, you're putting your body into a state of stress. And we'd rather have you with sustenance. What is going to get you pregnant dietary wise versus what you have when you're pregnant versus what you have postpartum, which versus what you have when you have completely different goal set in mind? All the nutritional principles are different. Like you can't apply one set of principles to all the different phases and expect to have great results.
Yeah, so we tell people to eat. You have to eat to lose weight. So at least
Good
three
for
meals
you.
a day, and
Yeah.
then number of calories, energy in, energy out. It's not good food, bad food. It's not salad is good and bread is bad. It's how much. So the whole thing, the game is eat breakfast, lunch, and dinner, aim for 1,100, 1,200 calories, depending on your body size. And then we get people to lose weight that way with a structure of saying you have to eat and you have to count your calories and you have to work out.
Mhm.
GLPs or the peptides that come in boost all that because it's so much easier to eat breakfast, lunch, and dinner, 1,000, 1,100 calories if you're not starving. The great thing about those drugs is they really do curtail cravings, desires, chocolate, alcohol, smoking, whatever it is. You don't want to do it anymore. It helps with insulin resistance. So a lot of polycystic patients, the GLPs are incredible at really undoing the metabolic mess that their body is because of their hormones, and then slows down stomach emptying. So you can't eat that much. So that's where some people get in trouble. If you don't listen, like you overeat or drink alcohol or have sweets, you get really sick. So again, if you educate patients, small meals, number of calories, workout, the GLPs are an incredible adjunct. They don't do the work. I've heard so many stories of people like, oh, I was on Ozempic for 6 months. I didn't lose a pound. I was like, okay, were you hungry? Oh, no, I wasn't hungry at all. I couldn't eat a thing. That's just not education. If you're taking so much you can't eat anything, that's too much. If you're taking it and then not losing weight, you're not doing the right things to be able to lose weight, which is eat and exercise. So those all go together for the fertility discussion because you have to fuel those eggs. You have to get it in a place where your BMI is in somewhat normal or a slightly overweight range. And the data on the fertility benefits of being in those ranges is just undeniable. And the products that we have, the peptides and those things that help you get there are incredible. The pellets, what it does is metabolism. So when you're a 20-year-old, you can get away with a few cheat meals, you can get away with whatever, and then when you go work out, bing, it's gone. Well, when you go through life and your hormones start getting lower, any little calorie sticks to you because your metabolism is slowed down. You've lost muscle, you don't have the same metabolism, so it's really hard to maintain, easy to gain. So when we restore your metabolism back to 20-year-old level, now you're like, you could feel the energy. Hey, I want to work out. And once you do work out, like I'm not exhausted, not everything hurts, but you start to see results. You're like, wait, you know what? I can get on the treadmill and go 10 minutes. Let me try 15. I can lift 5 pounds. Let me try 7. And so as you start feeling better, you start taking better care of yourself. So the pellet goes into the exercise component, but also into the metabolism component. So it's a great one too to combine the hormones. Like I said, if the hormones are 100 level, this is the peptides are 200 level, you're really combining the treatments to get even better results.
Yeah, so it's basically giving you like the energy and the willpower as well on top of the other physiological benefits. It's really great. Now, I know that you also do vaginal rejuvenation. Tell us about that. I
Sure.
think it's more for after the baby, but I don't know if that's entirely the case. But educate us, Dr. Jovanovic.
Of course. Like I said, we started with just regular OBGYN, regular cosmetic surgery, and patients started asking me about labiaplasty, about hood reduction, about the labia majora, which are the fat pads on the sides of the vulva. So as you go through life, the structures, we have two big parts to vaginal rejuvenation, if you will, because that word doesn't mean anything. We have the outside structures for appearance and the inside structures for function. So the appearance parts, you have the fat pads with the labia majora, you have the mons pubis on top with hair, and then you have the clitoris, the labia minora, and then the entrance to the vagina. So all those structures can change what they look like over time. Sometimes the labia minora elongate and they get in the way of your pants or when you ride a bike, or they get uncomfortable with intercourse. Sometimes the structures down there get deflated, like they're talking about Ozempic vulva. There's all these words for it. When you lose weight, the structures can change what they look like. But basically, it's what the patient wants. So we have several different procedures for based on the patient's happy or not. And it's all normal. Like one of the knocks on vaginal rejuvenation was the doctors are telling patients they're abnormal and like giving them a complex and telling people you need to have the surgery done. That is absolutely false. Like I have never said anything like that to a patient. Patients come to me and say, "This bothers me. What can I do?" So we have these surgeries, like I said, that Dr. Matlock pioneered that we've been doing for almost 20 years that are actually reconstructive surgeries. So they're variations on cancer reconstruction and pelvic floor reconstructions. All these reconstructive medical things, we vary them for cosmetic. And we use a laser too, and we've innovated all of the ways we do it so that it can be safely done in office. The recovery is not as horrible as some of the older recoveries. So we have the procedures, and now we have minimally invasive things to do, like fat transfers, and we have lasers. So we have a whole bunch of things for appearance, and then we have for function. So as your body changes, sex may change. You may feel a little more loose. You may feel a little more dry. The muscles may not be as strong. So we have treatments for each one. So for example, we have the Emsella chair, which is a chair you sit on fully clothed. It's an MRI magnet that does 10,000 Kegels for you in 28 minutes. It would probably take a woman a month to do 10,000 Kegels. So
Well,
the
yeah,
protocol,
who really likes doing those? Like, I love the guy. I
so this
was
does it
like, oh
for
no, I
you
should do the
without
Kegels
taking your
too.
clothes off. It's really neat. It's an MRI magnet, and you sit on it for 28 minutes, twice a week for 3 weeks, and it 90% improved bladder function, pelvic floor, better sex, cough, sneeze, news, urine. So those are for the muscles, and you don't have to do anything. There's no downtime. And then we have lasers with 2, 3 days of downtime for the skin on the inside. And then we have surgeries where we actually reconstruct everything. They're 2, 3 hour procedures.
Wow, this is amazing. There you have it, everyone. Dr. Jovanovic, he'll make you your ideal weight, your ideal mood. He'll help you get pregnant, then he'll deliver your babies and fix everything up. So thank you so much, Dr. Jovanovic. Where can our patients find you?
Sure. So my office is at 930 Fifth Avenue on 74th and 5th near Central Park. We also can be reached by phone. It's 212-249-6709. And our website is drjovanovic.com, drjovanovic.com.
And listeners, that'll all be in the show notes for your viewing. Thanks for tuning in. And thank you so much, Doctor, for joining us.
Thank you so much for having me. I really appreciate it.